clap.
Hi, everyone. It's good to be with you, at least in a digital way. And we're here today to first talk a little bit about the intake process that you'll engage in with the SPLs, and then give you a sample of what that process might look like. And we talked to you a little bit about it during our special topics, the function of intake and why we're engaging this, but just to kind of revisit that, an intake session is an initial meeting with a client or patient. And it's your first point of interaction. It's an opportunity to gain information, to make some observations, to guide the future treatment process, and also to be able to document and gather that information in a way that informs you and may also inform others in your treatment setting. Remember that we try to gather as much information as we can, and we have a intake form that you'll be using that guides you through different categories such as personal background, treatment history, medical history, family history, things like that, and can gather a lot of information. But also remember, it is a snapshot in time. The client is going to share with us what they're willing and able to share with us, but it's a first meeting and they may not fully trust or know us enough to share, say, details of trauma history or other things that may later become very relevant to treatment. So we take what information we can get and attempt to get clarity in the information that they're able to provide to inform the treatment process.
Exactly. Yeah. Like, as you're saying, Scott, it can really look, structured or unstructured. In some settings, there's a point person that does the intake. In other settings, the therapist does it themselves. In some settings, you're filling out, a 20-page packet. In other settings, it might be a 1-page. And at the end of the day, we're just letting our client know we want to get the fullest picture of who they are and what brought them in the door so that we can create the best and most successful outcome for them.
Mm-hmm. Exactly. And speaking of the structure versus unstructured, in the intake form we've given you, it kind of goes through in a sequence. Sorry. It goes through in a sequence, but we also wanted to have a semi-natural flow of conversation with the patient. So if we're talking to them and we're not quite to the family history section of the document yet, but they begin talking about their parents and their siblings, we have a choice. We can say, hold on, we're going to get to that in a couple minutes. I have a couple more questions to ask you first. But more often than not, we might just say, okay, great, tell me a little more about that, and write in that section the information that's being shared. So know that when you're going through the process with your SPL, if you have that type of experience, you don't have to follow exactly the script of the intake form we're providing for you. And the other important aspect of the intake process is building rapport. Right. And getting to know the client and them getting to know you. And something, I came to recognize in my work was that in some settings, you're going to be waiting in a room and the client's going to come to you. But in many settings, you're going to go meet the client in a lobby or somewhere else in the treatment facility, bring them back to the space where you're going to do the intake. And so the session and rapport building really begins at the point of contact. When we greet them in the lobby and we say, hi, I'm Scott. I'm going to be your intake coordinator today. Please come with me. We're going to chat for about 30 minutes, whatever the little spiel we give is. That's the beginning of that rapport building. Mm-hmm. And as we walk back, we may, chit chat a bit. So thinking about that, you won't have that experience in this SPL experience, but just in the broader understanding of how that building of rapport can happen through the intake process.
Exactly.
And I think I just wanted to circle back to name that Abby was describing the intake, and it's sometimes big and sometimes small. And just to bridge that over into creative arts therapies assessments, which may be a part of your task as well. Sometimes the intake is a part of a larger assessment packet, which includes some art therapy or DMT or music therapy assessment techniques. And sometimes they're separate processes, and sometimes there's somebody else doing the intake, or you may be doing the intake for someone else, and that gets handed to a clinician and is then followed up on with a music therapy assessment, say, for myself. So I've certainly worked in settings where I've received some basic information through an initial intake and then conducted additional assessment of my own to fill in some of the gaps that I might have found and to get understanding of the creative process inside of things to assess that. So intake, it sometimes stands on its own or is sometimes a part of a bigger assessment process.
Mhm. And at the end of the day, really nothing is more important than the relationship. So, I gather what information I can, knowing that I can always circle back through. Just to provide one example to talk about from my own clinical experience as Scott has, when I did addictions work, people often told me, they drank or smoked or ingested a lot less substances than they actually did. And it totally makes sense. They don't know if they can trust the space, and that needs to build over time. And we also know what kind of trauma some people are coming in the door with. So these are all the factors that we're looking at. And we as the CAT counselors, we exist in this gray area, and we put the client first. And one of the ways that I also help to normalize the process is just to say to the client, look, I need to have a biopsychosocial, a broad picture about who you are. And in the end, it's really just about making sure you're successful. And a lot of clients, feel validated and heard just by, reiterating that what the process is and how it's going to look.
Mm-hmm.
So
in a moment, Abby and I are going to take off one hat and put on another to move into a role play of Abby as therapist and myself as client. And we want you to watch this, and it can serve as a little bit of a guide for you, a little bit of an example, but also to say that no clinician is perfect, and nearly every clinician gets in the moment of conversation and forgets to ask a question. And sometimes we have to circle back to that in the next session when the client be like, oh, I forgot to ask you this. Can you let me know about that? So likely that will happen with Abby and I. And when you review the video, feel free to review it and, make note of what you think we might have missed, or we might have glossed over a detail that seemed more important to you than the time that it was given. And that's just something to observe and to then integrate into how you do this.
Absolutely. I'll be curious about any critiques and very, very much welcome them.
So I am now going to hold a piece of paper up to the screen that says action. When the paper comes down, I am no longer Scott. I will be the client whose name you will find out in the course of the intake.
Okay. All
right. Action.
Okay. Hi, it's really nice to meet you. Let's see, I'm just checking out the form here. Is it Sean Maslow?
Yes, Sean.
Hi, Sean. Welcome. Is that your preferred name, Sean?
Yeah, I don't really have any nicknames or anything.
Okay. And just in terms of your pronouns, do you have a preference?
He, him.
Okay. Welcome to therapy counseling. My name is Abby Dougherty. I'll be working with you today. And I just first want to say I'm really grateful for your willingness to have the courage to come in today. And sort of our goal today is just to get a real broad picture of what brought you in the door, so we can really set you up for success. Having said that, if you feel uncomfortable at any time with any of the questions or have any concerns or need clarification, please do not hesitate to stop me. It's no problem at all. But just even before we get started, are you in a safe and quiet place where we can work together?
Yeah, I'm at home, and this is kind of my home office, or became my home office since I've been stuck at home, and I do have kids running around, but I should be okay to talk for a little while.
Okay, wonderful. I also have a young child, so I feel you there. These are some unusual times right now, and we will definitely flex into the moment. So just to get started, I just wanted to review some of the info that we just got initially with you when we talked over, when the intake person over the phone, just basic stuff here. So, for example, I have your date of birth as March 15th, 1980. Is that correct?
Yep.
Okay. And I know we talked about pronouns, gender identity, um, male with the
Yes.
pronouns. Okay.
Yes. No.
And how do you identify racially or ethnically?
Um, white. I guess white.
Okay. I also see they made a note here, Jewish. Is that also a prominent part of your identity?
Yeah. I was raised Jewish. I identify as Jewish. I don't actively practice in terms of going to synagogue or anything like that, but yes, I identify as Jewish.
Okay. And let me just double check here. You live at 1601 Cherry Street in Philadelphia, 19102.
Yep.
Is it okay to send you an email if we have any questions?
Sure. That would be great. Email's a good way.
Wonderful. And for your home phone, 215-436-1234.
Yep.
Okay. And then intake roleplay at gmail.com is your email address?
Mm-hmm.
Excellent. And your emergency contact I have here, I believe is your partner, your wife, Dana Maslow.
Yes.
Awesome. All right. And last question here. How did you hear about the counseling center?
I saw an ad on I think it was Facebook. It was on one of the social media sites. I saw an ad, and it just kind of piqued my interest because I've been feeling like I've been kind of struggling recently and needing to get some support. So I saw the ad and thought I'd check it out.
Fabulous. We've actually had a lot more folks kind of seeing us on the social media, online. Of course, we're all sitting in front of our computers, so not surprising. So thank you for that. Just wanted to double check. And then a couple questions we're going to start. So that's sort of like the general information I have from the intake coordinator. So now I'm going to start to ask you some questions that I'll ask you about your background, and then we'll kind of connect that to what brought you in the door. Does that sound okay with you?
Sure.
Okay. Could you describe your current living situation?
I live. We own a home and live with my wife Dana and our 2 kids plus a dog.
Yes.
And yeah.
Pets are definitely an active member of the family. I wholeheartedly believe that. So
Mhm.
we will definitely include them. And you said 2 kids, wonderful. And
Yeah, I
are
have
you? Oh,
a
please.
8-year-old and a 4-year-old.
Ah, so you are busy, very busy, I imagine.
Yeah.
Are they home during the pandemic or?
It's been tough. It's been inconsistent. Some days they're home, some days they're not, or I should maybe say weeks. Some weeks they're completely home. We've had some hybrid. It's just back and forth. It's so hard to keep track.
That is the truth. It really, I mean, uh, we can all add, teacher and all the roles of our schools to our CVs after this experience in history. That's for sure. Are you working or in school yourself?
Yeah, I work for Comcast on the kind of software engineering side of things.
Ah. And just with everything going on with COVID, are you home? Are you going into the office?
No, I'm home. I've been home pretty much since the start, and I don't know if they'll even have us return to the office once things clear up. Now that they see what work can happen without the office space, but they do have that big building in Center City, so I'm sure they'll
Right.
like to use it. We'll see. But yeah,
Okay.
I'm at home full time these days, which it's kind of hard being in the same space all day, every day.
I can only imagine. I even notice right now you're looking a little stressed. Are you feeling okay right now? What's happening for you?
Yeah, feeling a little stressed. I think, thinking about, trying to answer your questions and thinking about
Mm,
all that's going on,
mhm.
it's been in my head a lot, and kind of, kind of just rolling around in there as we're
Yeah,
talking about things, all that's going on, and all that I'm responsible for.
I believe it. I believe it. Before I jump into your family history, do you have any existing diagnosis?
Yeah, I was actually diagnosed when I was in high school with generalized anxiety disorder. I
Okay.
think I was, kind of towards the end of high school, probably like 16, 17 years old when I was given that diagnosis.
Okay. And did you go to counseling at that point, or how did you get the diagnosis?
Yeah, I did actually. I know you said we'll be talking about family history, but it kind of came about the same time my parents were getting divorced. And
Ah, okay.
I was, yeah, I was, I guess, referred to the school counselor first, who recommended to my parents that it might be beneficial to speak to somebody and maybe explore treatment options. So I did, for about, I think for about like 6 months, maybe a year. I saw a counselor for therapy on a weekly basis.
Okay. Okay. And did you find it helpful, the
Yeah,
therapy then?
at that
Okay.
time I did.
Awesome. As we're going through, if there's anything that, seemed to work well for you then, I know it's a very different time in your life, but I'm happy to, kind of explore at least what has worked for you in the past as well. But I know that we kind of touched base here on family, and I was just curious about how the important people in your life are viewing what's coming up for you.
Hmm. Yeah, like I said, my parents are divorced, but I'm still very connected with all of them. They're all kind of local, and um, that's great for the most part, but it also adds some stress sometimes, especially in the pandemic, when they all love the grandkids and want to see the grandkids, and I don't know if it's safe, and everybody's having to make choices and constantly decide what to do and what not to do, and can we have the holidays and not, and it's just
Yeah.
as much as they can be helpful and a support in my life, it's honestly added an extra layer of stress, even more than normal.
Okay. Okay. I just wanted to let you know I hadn't mentioned this earlier. I am taking a couple notes to fill out the intake form. But at any point, you are welcome to see these notes. It's really just to help me remind, I'm sure you can relate to this as a parent. Hard to keep the memory, so it's good for me to write it down and have something to go back to. But if you have any questions, I just wanted to put that out there.
Excellent.
Um, so, I was also curious. You mentioned having the anxiety. What's your partner actually think about the anxiety and just everything going on right now? And lots of reasons to be anxious, but it sounds like it's kind of elevated for you recently.
Yeah, I mean, she notices it. I notice myself that I seem to kind of have a shorter fuse with the kids. I have kind
Hmm.
of less patience. I'm raising my voice with them more, and I
Yeah.
think my wife has noticed that, so tries to help out by sort of tagging in and trying to handle something and give me a break. Um, but I think she's concerned, and was very supportive when I mentioned the ad I saw, and was supportive of me reaching out maybe for some therapy or other support.
Okay. Well, it's good to hear that. It sounds like you had some family support for coming in today, and that always makes it a little bit easier for therapy to be successful. So I'm glad to hear that you have some good social supports in your life, even if at times it sounds like they add to some of the stress that's going
Mhm.
on. And we can explore that, even further as we move along here. Uh, just to check in, do you have any other physical or medical issues that we should be aware of?
Um, I do have high blood pressure. I take blood pressure medication,
Okay.
and my doctor tells me to watch my stress.
Yeah.
Um,
Okay.
and so I imagine he would be supportive of me trying to manage my stress and anxiety through. I do take medication for that, but also
Okay.
that's something he's talked to me about before, actually. So yeah, other than that, though, I'm pretty healthy.
Okay. So we're feeling the anxiety for sure in the body, it sounds like. Or what medications have you been able to take that maybe have eased some of that for you?
Um, well, I did when I started with that therapy as a teenager. I did take some medication for a little while. It
Okay.
was a while ago now. Maybe Prozac,
Okay.
um, and
That sounds about right for that age and that
it
time
was
period.
yeah, it was helpful. I mean, it had some, made me feel a little funny, but it was helpful. Um, but kind of working with the therapist, I reached a point where it seemed like I could maybe move off the medication and try to work with other ways of managing, which I've been okay with for the most part, up
Okay.
until now, and definitely
Okay.
feeling like
Um,
whatever I've been doing isn't quite working anymore.
I'm curious about sort of, I definitely want to circle back to what you've been doing to kind of cope and hold some of this anxiety and stress in your life, because that's going to be important to our work together. But just before I go there, have you ever had a history of drug and alcohol dependency?
No, I mean,
Okay.
I've used alcohol recreationally, and experimented with various things in college, but nothing, consistent or that I had a dependency for.
Okay. Okay. Any family history with regards to that, substance abuse or anything like that, addiction?
No, not that I'm aware of.
Okay. Okay. So we've talked a little bit about, having received past treatment. This might be a good place to ask you about some of what you tried before with the other therapist, and what if at all was successful, and what's not working for you now, or how is it hard now or different? Uh,
Yeah, that's a good question. Um, I mean, I think I'm having a hard time really naming what's different because it just feels like maybe it just feels like it's a little more full, a little more overloaded than usual. It's not necessarily new, although this whole pandemic is new.
You're right.
But family and work and all the stressors are just kind of heavier and bigger than usual. And so, I mean, but at that time when I was talking to a therapist, early on, and it was helpful for sure to feel like I could talk to somebody that was not my family, was not my parents, or any siblings or anything. Um, so I can imagine that that's something that hasn't been in the mix for me in a while, and I can imagine that being helpful. I've also I've kind of had some things I would do, like some breathing exercises,
Okay.
um, often help me fall asleep. You may also notice this piano behind me. I do play
Yes.
music, and that's
Ah.
definitely an outlet for me. But I think that's also something that I've been missing is often making music with friends and
Hmm.
um, have an opportunity to connect socially and haven't had been able to do that really at all during this time. So I try to play for myself, and that feels good sometimes, but I find right now I'm often just too depleted by the end of the day to want to do that. Without other people, motivating me to play with them, it's I think that's a coping resource that hasn't been working for me as much as usual.
Mm. And that makes sense. I mean, social isolation is just, obviously we're all kind of dealing with that in different ways right now. And, Certainly as a therapist, I understand the need to really be in connection, to feel motivated. So I think we can explore some of that together as well. And that will, definitely support some positive outcomes for you. And so we will circle back there. Just to check in, do you have any history of a language delay or learning disability or anything like that?
No.
Okay.
Mm.
How about, we know you have a history of anxiety. How about of trauma or depression?
Um, no, nothing that's ever been diagnosed.
Okay. Okay, great. How about any history of either, self-abusing yourself or in any way or being aggressive towards others?
No. Mm-mm.
Okay, great. So let's talk about this music piece because that fits in with our next section here perfectly. I'm going to guess the first question I have to ask you is, do you enjoy the arts? And I certainly believe music to be in there. And could you tell me a little bit about your relationship with the arts?
Yeah, I've been playing music pretty much my whole life in some way or another. I started off as a kid just taking lessons and then playing in band in school. And, um, I wasn't quite good enough to pursue it professionally. So as I moved, beyond high school and into college, I had to put focus in other places to pursue my career, but always kind of had music there in the background, would find, friends or outlets to be able to play music for fun, a little bit of performing, bars and things like that. Nothing too big a deal, but
Okay,
it's always
cool.
been something that I just enjoyed doing.
Oh, that's fabulous. Well, I use a lot of creativity within my therapy. So this sounds like this will, we can pull in some of your sources of strength into our practice, and our work together. So I'm happy to hear
Good.
about that. Um, it sounds like, based on what you've told me, it kind of brought you in the door is the anxiety and just feeling more elevated due to COVID. Is that what you'd like to have our work focus on?
Yeah, just how to manage it. I find, I'm having trouble sleeping, and I'm just like I'm tense a lot,
Yeah.
and I'm just like I said, like all the I'm feel like I'm constantly having to make a decision about school and can the kids go to school or not, or
Yeah.
can they see a friend that they really want to see, and I don't know. I almost feel paralyzed in how to make those decisions, and I get overwhelmed, and
Yeah.
and just it's just all so stressful, and trying to be a good parent and give them attention, but also keep up with my work that needs my attention. um
It's the
and
truth.
it's yeah, I just really kind of feel on edge a lot of the time, and
On edge.
have a hard time relaxing, really
Hmm.
hard time winding down at the end of the day. And I think that's,
Uh,
my mind's still spinning. I can't fall asleep, or if I do, I wake up partway through the night and can't fall back asleep.
so some running thoughts. It sounds like maybe even a little insomnia.
Mm, yeah.
Mm, okay. Would you describe yourself as spiritual or religious?
I'd say more spiritual than religious if I were to
Mhm.
pick between the two. Like I said, I do identify as Jewish, but connect more on a spiritual level, I think, than the religious practice.
Okay. And that's sort of the holistic intake experience here. Is there anything else that you think is important that I should know, just so we can, again, just fully get this full picture of you and what's happening?
Um, I guess you asked about traumas, and I guess maybe I don't maybe when I hear that word I think about people who have been like abused or things like that. But I had a sister who passed away
Mm,
about 10 years ago due to a
okay.
car accident. So I guess maybe that does constitute a trauma of
Yeah.
sorts. So that was certainly significant in my life. And she was, another person who was a support for me. So it's been
Mm,
10 years now, but I still miss, she's somebody who, when I was feeling stressed like I've been, I could call and talk to about it, and
Ah,
she's not there.
yeah. Oy, that's a pretty significant trauma. So thank you for your willingness to share that with me. And it also helps us to think about, where and what have we learned about how to take care of ourselves, especially when we're feeling overwhelmed, stressed, anxiety, and really thinking about what's going to work for us best. So you've given me a lot of really wonderful information today. I'm so grateful for your courage to share and just to sort of tell you about next steps. If you feel comfortable and this has felt good to you, then next week you'll come back. I'll talk to you a little bit about some of what you've shared with me, provide you some more information about anxiety, and also let's start to, give you some immediate relief. Let's look at some coping skills, some ways to relax that you can incorporate right now. And we'll start there. Does that feel okay for you?
Yeah, that sounds really good, especially those kind of immediate practical things I can start trying out, because I think I need to do something.
Great, great. Well, you made the first step, you made it here. So great, thank you for this. And why don't we take a moment now and set up our appointment for next week? How does that sound?
All right, sounds good.
Okay, thanks.